going right now. Okay guys, I want to give you some review instruction of parts that we've already looked at, and then we'll take you into the next phases of the dissection. We've got the throat area all opened up here. Now, fourth block, I don't think I got to you with this instruction. There's a bone right here, a V-shaped bone called the hyoid bone. This bone is the only bone in the entire body that does not articulate with another bone. The tongue attaches to that bone, and on the other side we've got a number of different muscles that extend from the lower aspects of the hyoid down to the clavicle, the collarbones, and the sternum. I have teased all of those muscles away. Anyway, hyoid bone. We notice that we have an enlargement of the windpipe right here. In review, that's the larynx, also known as the voice box. In a little bit, I'm going to cut that out and we're going to look at the inside of that. You may recall that this is the thyroid gland laying right here, and we see below the thyroid and extending from the larynx on down to the lungs, this ring-shaped tube called the trachea. So if in an emergency situation an individual is unable to breathe, the paramedics will perform what's called a tracheotomy, and they will cut between the cartilaginous ribs of the trachea and they will insert an air pipe. So if we have an artificial respirator operating, they're going to stick the air pipe into the trachea. On each side of the trachea and the larynx, we do see a latex-filled artery here, and on the other side we have a latex-filled artery there. Those are the common carotid arteries. The one on the right, very complex terminology, is called the right common carotid artery. And the one on the left common carotid artery. Associated with each of those, you maybe can see that there is another blood vessel that is not filled with latex, and it's clearly much more flexible, not nearly as rigid or strong. This is a vein. This is the jugular vein, and again, using the terminology of left and right, this would be the left jugular vein. The term vein identifies a vessel that carries blood back to the heart. Arteries carry blood away from the heart. Artery A, away. So the arteries, like the carotid, need to have a much tougher wall because they experience much higher blood pressure. So we've got the jugular vein there, and on the right side we have the collapsed jugular vein here as well. All right, review as we move down into the thoracic cavity. You'd be reminded that we have the heart right here. We have glandular material overlying the cranial aspects of the heart toward the head. That's called the thymus gland. The thymus gland is especially significant during fetal development. After birth, the thymus gland does depreciate in size. So in our hearts, we would not find such an extraordinarily large mass of thymus gland. We would be reminded that the heart itself was encased in a bag, and I have some remnants of that bag right here, the pericardial sac. The pericardial sac. I'm having trouble getting under that, but you can see the bag right there, what's left of it. And as a matter of fact, you all probably noticed that when you opened up the chest cavity, that all of the organs of the chest cavity have membranes holding onto them. We still see some remnant of membrane right here. We do not have organs just bouncing around inside of our body. They are held together with connective tissues. These large organs on the right and left side of the heart and below the heart, these are the lungs. And you would notice that the lungs are in fact not one single structure, but actually multiple structures all put together. We use the terminology lobes. There are several different lobes of lung. During dissection on Thursday, Ms. Carr will lead you. I would like you to count the number of lobes of lungs. That will be one of your responsibilities. We look down here on the caudal aspect of the heart, and we discover a pipe moving through the thoracic cavity right here. It's a very flexible pipe. That is the esophagus. And of course, that's a food pipe. The esophagus carries food and fluid from the mouth to the stomach. Now, we have not yet exposed the stomach. I will in a little bit. But you observe that the esophagus is rather long. It does have to extend all the way through the thoracic cavity. You might think of your own circumstances. Maybe you've swallowed an ice cube and you could feel the coolness move all the way through your chest cavity. So it's a pretty long pipe, and it's got to interface through the lungs and the heart to get through there. We're reminded of this wall of muscle right here that serves the floor of the thoracic cavity. That is the diaphragm. That is a muscle, and when that contracts, it squeezes the thoracic cavity and helps us to breathe by forcing air out of the lungs. When that thoracic cavity is relaxed, when the diaphragm is relaxed, that causes a vacuum, which helps to draw air into the cavity. Some of you have experienced Heimlich maneuver, where we artificially on the outside put pressure on the diaphragm area and compress that cavity, and that will cause maybe food to be upchucked out of a blocked air pipe. All right, I'm going to do a couple of things right now. I'm going to take out the heart and the lungs. So this is something I'd like you to do in class. That'll be the first thing that you're going to do, is you're going to dig out the heart and lung. Now, to do this, I'm going to use my finger, and I'm going to try to tease away the connective tissues that are holding these organs within that cavity. And when I do that, I've got some fluid there. I'm going to carry this cut a little lower so the fluid will drain out of there better. Draining that out of there. As I get my fingers back underneath there, I discover that we've got some pipes underneath. Okay, so I've removed all the ribs here, and I have some ribs still, and we've got the backbone down here. Now you see there's a pipe right here. That is not the esophagus. This is different than what we just looked at. That is a big old vein that carries blood from the lower body back to the heart. That is called the inferior vena cava. And literally stuck right underneath of the backbone, we've got a huge artery right here. Many of you will already anticipate the name of that artery. That is the aorta. That is the largest blood vessel in the entire body. It's a monster. It's very tough, and you will see when I cut this that it is filled with latex, and I'm going to go ahead and cut that right now. And there you go. You see the red latex inside of that vessel. I'm going to cut the inferior vena cava as well, because I do need both of those out of there. All right. Now I'm actually going to do maybe more than what you will. I'm going to try to get the entire reproductive tract intact coming out of here. So I'm taking off the jaw. This is pretty morbid, I know. I'm going to dismember the tongue, cutting the ligament on the lower aspect of the tongue, teasing that out, and I've got the jaw out of there. So that's the mandible. It's now out of there. And because I've done that, you can see that the tongue does have muscle. The tongue is a muscle itself. It comes down here and attaches to that hyoid bone. Now I'm going to go on the other side here, and I'm going to be trying to get this all out intact. I'm cutting through the soft palate here now, and I'm teasing. And we are reminded there's the epiglottis. We've got the hole in the epiglottis leading into the trachea, actually into the larynx first, but on into the trachea. Laying underneath of the trachea, we have a pipe. And many of you are anticipating what this is already. This is the esophagus. I'm going to try to separate that from the larynx and the trachea. Having pretty good success in doing that. I'm teasing that off. I'd like to leave that intact so we can see it running all the way through the thoracic cavity. I'm cutting carotid artery here. I'm separating that esophagus as I continue to work down. Now, there is such a thing as a heart-lung transplant, so you can imagine a surgeon, wow, isn't that something? A surgeon would be involved with taking all this stuff out, just like you and I are right now. They, of course, would be a little more gentle, I suppose. It's not an easy surgery. Turns out I did accidentally cut the esophagus right there. That's okay. There's that. Okay. And I almost have a little more connective tissue. I'm going to cut right there. I now have the lung and the heart out. And you can see that I do still have the trachea intact. I'm going to do something kind of goofy here. I'm going to do a tracheotomy, and I'm going to stick a straw inside there and see if we can inflate the lungs. Sometimes I can. I don't know if I'll be successful on this occasion, but we're going to give it a try. Kind of fun. Black drinking straw here. And I have just entered that into the trachea. How you doing, Mia? Mia's my filmer. She's doing a great job. Mia doesn't know necessarily, but this video could be used for years to come. Now I'm gonna blow in that straw, and we're gonna see if we can get the fluids of the lung to evacuate a little bit. It's very important that I don't suck in. That would not be enjoyable. I may have too many leaks in our lung, but you do see that it's starting to inflate in certain areas. The color is changing a little bit as the fluids are evacuating and it's being restored to its normal, flexible origin. We're seeing it a little bit right in here, a little bit of inflate and deflate. Okay, so that was kind of novel. I'm getting lightheaded, so we're going to stop. I'm going to have you, once you've done that again, I'm going to have you count the lobes of lung. And we're going to go ahead and get the heart out of there. I want you to take some time, not too long time, but a little bit of time to look inside the heart. So you just cut that out of there. And a couple things I would point out to you on the heart. I'm going to get that thymus gland off there. So we get a better look. Take the rest of the pericardial sac off of there. And once I've done that, we can see a couple of structures laying on top of the heart. These look like ears on the heart, and by golly, the term auricle is used to identify them. Auricle means ear. So we've got two auricles, and in the lower muscular part of the heart, we have two ventricles. So I'm going to have you cut through the heart, cut the auricles off the top like this, so you can look inside there. I'm not going to show you that because I want you to have this experience. And when you do, you'll see that there are a couple of pockets in there, and you'll be able to see the spaces down inside of the ventricles. You can see that there's a little bit of a groove right here. That groove marks the boundary between the two ventricles. This is the right ventricle, this is the left ventricle. The left ventricle includes the tip of the heart. And those two ventricles, very muscular, and they're responsible for pumping blood to the body. The right ventricle specifically pumps blood to the lungs, and the left ventricle pumps blood to the head and to the lower body. And it has to generate enough force to get blood all the way to your toes, but also back again. All right. So I'm going to set that aside. Again, I goofed up. I did inadvertently cut the esophagus, was attached right there. So that makes this the inferior vena cava. I'm squeezing on the abdominopelvic cavity, and I'm getting a little fluid come out of the inferior vena cava, and we have the aorta down there, diaphragm. Let's go into the abdominal pelvic cavity. I think you guys will have time to do that. I want you to. I'm cutting toward the umbilical cord. I'm going to cut around the umbilical cord, not going through it, going around it. And I'm going to stay wide here. Got a lot of fluid in there. I'm going to have to go rinse this. Tease the tissues. We do tend to find a lot of stuff, a lot of goo in the abdominal pelvic cavity of a preserved pig. Specifically the liver starts to break down, and it emulsifies, and we just get nastiness. So I'm going to be rinsing that out. I'm cutting on both sides of on the back side of the diaphragm now, just peeling the walls down. It's a lot easier cut because we don't have ribs down here. I already removed the ribs. Starting to see some intestines there. Oh, that's good stuff. Getting that cut all the way to the bottom so that the fluids can drain a little bit. Mia's going to walk with me. We're going to go to the sink and we're going to clean this out a little bit. Oops, stuck my hand in the camera. All right, a couple of things we're going to look at from the get-go. We've got our umbilical cord, and you notice that we have a vessel that's extending from that umbilical cord through this big brown organ right here. This is the liver. That's the largest, well, I shouldn't say it's the largest, it's very massive, huge organ. Immediately on the back side of the diaphragm, I'm flapping the diaphragm here. This is called the umbilical vein. After we are born, the umbilical vein changes into a ligament called the umbilical ligament. That ligament helps to keep your belly button as an innie. Think about that. If that ligament ruptures, then your belly button pops out like a done turkey at Thanksgiving. Out she goes. So I'm going to cut that. I'm cutting the umbilical vein. Now, as a consequence of doing that, I have a better look at, you see a couple of vessels right here. These are the umbilical arteries. All right, umbilical arteries. And they carry blood from the pig through the umbilical cord up to the placenta of the, and do the gas exchange and the food exchange and the waste exchange, all that with the mom. So, in between the umbilical arteries, we have a elongated bag right here. This is going to surprise many of you. This bag is actually the pig's urinary bladder. So our bag is spherical. There's the elongated kind of pouch. All right, we're going to come back up here. We're going to look at digestive organs. The liver is especially a digestive organ. It makes bile, but it also is involved with removing toxic materials from our body. Some of you remember from 8th grade health that the liver metabolizes alcohol. I flip that liver open on the back side. I don't have to cut anything. I just flip it open here a little bit. And embedded on the right side of the liver, right here, you can see that I'm teasing out a little bag. That is the gallbladder. And that gallbladder stores extra bile. If we track that gallbladder, it's got bile ducts that lead down to eventually dumping into the small intestine. All this stuff is small intestine. And bile is needed for digesting fat. We have a bag right here. It's kind of squishy. It's filled with fluid. There's the stomach. There's the stomach. So our esophagus, right here, there's the remnant of the esophagus. I cut it. There's, as it's extended up here. That esophagus goes through the diaphragm, and it's attaching into that stomach. You see that there's a tongue-like structure on the left side of the stomach. This is the spleen. That's the spleen. One of its primary jobs is simply to store extra blood for us. So if we got in a catastrophic accident, we'd have some reserves, like a Red Cross right there inside of our body with the spleen. All right, I'm looking down below the stomach, and that proper terminology would be caudal, exposing this out a little better for us. And we see all kinds of intestine here. And by the way, when you get this far, you can take, oops, didn't mean to saturate or lacerate that. I did. You can take the liver out. You would discover that there are multiple lobes of liver as well, and I want you to count them. We're going to go ahead and take out all of this stuff also. I'm going to try to keep it fairly intact. Now, what I've got right here, that's the rectum. That's the straight pipe of the digestive tract, the very end of the digestive tract, and that, of course, leads to the anus. I'm going to go ahead and cut that. And now I'm going to do my best to take out the intestine and the liver and the stomach. Okay, I've got the liver out. Liver's out, so I can count the lobes if I choose to do that. You guys will. Let me see. I think I've not done it this way before. I think I'm going to go ahead and cut the diaphragm. This makes sense. Yeah, all right. As a consequence of doing that, I still have the diaphragm right here. And there's that stomach. Right here, this bag. You know, I'm pulling the spleen off, taking the spleen off. There we go. Now, something I want you guys to do, it's so cool. You can see right here, there's the esophagus attaching into the stomach, right in there. All right? Now, you would also notice at the other end of the stomach, it attaches into the intestine. I want you to feel, squeeze in this area right here. And when you do so, you're going to feel that it's pretty rigid, pretty tough. We have a circular muscle there called a sphincter muscle, pyloric sphincter, and it controls movement of stomach contents on into the intestine. Stuff doesn't just go in the stomach and flow right through. We need to have a door open for it to go. The stomach itself is muscular, and so when it's time to evacuate, the stomach can compress and squish that stuff out of there. We'd also notice, again, where the esophagus enters the stomach, there's another sphincter, the esophageal sphincter, and that helps prevent stomach contents from going back up into your throat. Sometimes that sphincter leaks. That's called a hiatal hernia. So you've heard of that. That's going to contribute to some pretty serious heartburn. I just took off the diaphragm, and I have left that just the stomach. I'm going to have you guys separate that stomach from the rest of the mass. And I'd like you to cut the stomach open and look at the insides there. You might find some green-colored stuff. We call that meconium. It's a mixture of bile that came from the liver and amniotic fluid that the piglet would have swallowed, as well as some preservative. All right, so now we've got all this intestine. I think one of the things that you guys can do as part of this class, as you finish things up, we have the great intestinal tease competition. I'd like you to take your tease needles and your scissors, and I'd like you to see if you can't get this intestine torn apart and see if you can turn that into a big old rope. We've had intestines that have stretched over 300 centimeters before. Let's see what we can get in terms of a max size with you guys, maximum length, without breaking it. You would notice that the intestines are all held together. The connective tissue that holds them together is called mesentery. Did I use the term mesentery just a little bit ago for the stomach contents? I meant meconium. This is mesentery, and in many of your circumstances, not so good in mine, but you'll be able to see that the mesentery is loaded with blood vessels. You see a little bit of red latex in there. We've got huge blood supply to the intestines, which is not a surprise because we need the blood to pick up the food that's been digested by the intestine and carry that throughout the body. So you're going to tease that apart, the great intestine tease competition. We are on. I'm going to do another female pig, so I'm going to quickly show you some female parts here. I don't know how clear it is, but you can see. Can you see these two wings of tissue right here? You remember the other day I showed you on the slide presentation the uterus of the pig and how it has two different branches. It's kind of like a V shape. Well, there's the uterus of this pig. All right? Winging off right in there. And sitting right here, we have an ovary. And there's an ovary on the other side over here. A little difficult to see. Now, as I tease this tissue away, oh my goodness, looky, looky, we discover that we have pipes coming down through there. Again, there's an ovary right there. Of course, the uterus is going to attach to an exit pipe heading out there. That would be the vagina going out right there. There are those two umbilical arteries coming down. They have to attach to the aorta, getting that rectum out of the way. And when I do that, and I'm teasing right here, we can see where the umbilical arteries come in and do merge with the aorta. You see that right there. See that merging? So as the baby pig's heart's pumping blood through the aorta, it's going to travel through the umbilical arteries up to that placenta. Now, you might notice I have teased away the walls of the abdominopelvic cavity, and my goodness, we have exposed another organ right here. That's a kidney. The kidney is literally embedded in the wall of the abdominopelvic cavity. It's not in the cavity, it's in the wall of the cavity. There's very little tissue that protects it. I'm going to show you the bottom of the rib cage is about right here. And so we've got quite a bit of kidney that is exposed below the ribs. That makes those kidneys a little bit vulnerable to getting damaged. There are three pipes that enter and exit the kidneys. We've got what's called a renal artery. We have a renal vein, and then we have a pipe that carries the urine down to the bladder. And that's called the ureter, and I think I severed it on that side. Let me see if I can preserve it on the other side. I'm teasing through the tissue. Do a little more careful work on this side maybe, so we can see the vessels. There we go. There's the renal artery right there. You can see it merged with the aorta. There's the renal vein going in right there. We see the inferior vena cava right there. And I don't know, where's that ureter? It's a little bit fragile. I don't know if I'm going to detect the ureter for y'all. Looks like I'm not. Okay, so we have the kidneys right there. We are almost done with today's. Splash myself. Splash myself again. Did I splash you, Mia? Good. If you have a male, you'll be able to look at the gonads. I don't think you're going to get that far. You'll probably just stop because you're working on intestines right now. But trying to expose for you the reproductive tract down here. There's the vagina right there. All right, Mia, go ahead and shut it off.